Now we proceed further into the session. I request our President, Dr. Gopal Krishna.
Good evening, ladies and gentlemen. Respected speaker of this evening, Dr. T. Murali, Vice Principal of Dev Homeopathic Medical College, and our Vice President, Dr. Anand Megji, our General Secretary, Dr. Durga Prasad Rao, and our executive members and all the office bearers of our association and esteemed dignitaries in the auditorium and students and friends. I extend a hearty and warm welcome to you all to Dr. T. Seshachary Memorial Oration and Dr. D. Lakshminarayan Memorial Oration. Dr. T. Seshachary was one of the founder members of our association. He was a great personality. He was a civil servant in our erstwhile Nizam government and later in Andhra Pradesh government. Held many senior administrative posts in the government. And he was also a Central Council member and honorary physician to the Governor of Andhra Pradesh. So he was one of our founders. And he was also a honorary consultant in our association. And we pay heartful homage to him on this occasion on behalf of our association. So he was a great personality, a humble, selfless, dedicated homeopath and administrator he was. And at the time of his death, his savings bank account was having 35 rupees balance. So he never owned a house. He never got married. So all that he earned, he only spent for needy people. And while promoting homeopathy and rendering service through homeopathy to needy, sick people, and at this Modi Charitable Dispensary, he did a great service. So we owe a great lot to him and we pay our homage to him. So he was also instrumental in the enactment of the homeopathic regulations in Parliament and Central Council. So his contributions were great in establishing homeopathic system as an official system and recognized duly by the respective governments. So his contribution is really laudable. So we once again pay our respects to him. Thank you.
Thank you so much, sir, for enlightening us about the oration. Now I request our General Secretary, Dr. Durga Prasad, sir, to please come onto the dais and speak about HMAT and Dr. D. Lakshminarayana.
Respected President Dr. Gopala Krishna sir, and our Vice President Dr. Anand, and the beloved speaker Dr. T. Murali, and my Governing Council members, all the doctors and students. You know the HMAT, which is running for the last 5 decades and conducting Dr. C.L. Modi Charitable Homeopathic Dispensary for the last 5 decades. And some of the specialty clinics are being conducted since last 15 years on different systems and by the honorary physicians of our senior governing council members and some of the other outside the governing council members also. I thank you all for your support and service. And apart from the Modi OPD services and specialty clinics, we have been conducting memorial orations every month, annual memorial orations. For 12 months, we are conducting, on some months, 2 orations also we are conducting every month, memorial orations like this. And today, fortunately, we are conducting Dr. T. Seshachary Memorial Oration and Dr. D. Lakshminarayan Memorial Oration also. And apart from these activities, we have the internees posted by the different colleges to hone their skills for the clinical acumen, and they are serving better. And we do conduct medical camps also, and we publish a magazine, Medicina Futura Homeopathica, and which is being first introduced by our beloved Dr. Lakshminarayan sir. And it is continuing now. Now it is made online. And we distribute epidemic preventive doses also during all seasons for different problems till last COVID disease. And all these activities we are doing honorarily, and we thank all our doctors and other staff for their service, continuous service. And coming to introduce Dr. Lakshminarayan Memorial Oration, Dr. Lakshminarayan was one of the founder members of this association, along with Seshachary, Dr. J. Surya, and some others. And he was a postgraduate in science in the Indian Institute of Science, Bangalore, and got his doctorate in chemistry from Madras University. Dr. Lakshminarayan was a torchbearer of our association. Following the legacy of Dr. J. Surya, Dr. Seshachary served as the president of this association for several years and shouldered his high responsibility in bringing glory to the association as well to the homeopathy. Dr. Lakshminarayan developed his homeopathic career as a hobby, which started as a necessity while he was staying at Eluru, when his only son and infant on deathbed with diarrhea, who was saved by the homeopathy. So that's why he converted to homeopathy and started learning and practicing homeopathy. When he entered the ocean of the nectar of homeopathy, he started enjoying it more and more and become such a fan with conviction in the efficacy of the science that he stuck to it till his last. He never polluted his body with other systems of medicine and died with his mind alert till his end at the age of 79 years. Dr. Lakshminarayan was a systematic, meticulous disciplinarian with his healthy living lifestyle. He was an honest and dedicated person. Fortunately for him, he never needed hospitalization and relieving his sufferings with his own prescriptions efficiently till his last period. His last words to his wife were, "Sudha, homeopathy is so great and homeopathy is God." So that is the credentiality of the Dr. Lakshminarayan. Served this association for many years, and today we are lucky enough to conduct the memorial oration on his name also. Thank you. Thank you for your hearing.
Thank you so much, sir, for acknowledging us about the oration. Now I call upon Dr. Sai Shruthi ma'am to introduce the speaker of our oration, Dr. Murali Garu.
Good evening, everyone. Today evening, I welcome Dr. Murali sir for the oration. He has completed his BHMS in 2003 from Government Homeopathic Medical College, Kadapa. He completed his MD in Department of Materia Medica in 2008 from JSPS Government Homeopathic Medical College. He has a teaching experience of 12 years and a clinical experience for more than 20 years. At present, he is working as a vice principal at Dev's Homeopathic Medical College and Hospital, Ankireddipalli from 2019. He even worked as a senior research fellow from 2009 to 2012 in an EMR project conducted by Central Council of Research in Homeopathy under Ministry of Health and Family Welfare, Government of India. He published an article in Homeopathic Links and an international journal entitled Evaluation of Homeopathic Approach in Depressive Disorders in Hyderabad Urban Population, which is published in the year 2019. He was one of the organizers in conducting national-wide seminars like Depressive Disorders and its Homeopathic Approach, which was held in March 2008, and Homeopathy in Emergency Medicine, which was held in August 2010. He even written articles in national and state journals, both in English and Telugu. He worked as a resident editor for the journal Medicina Futura Homeopathica, which is a journal being published by HMAT for 1.5 years. With this, I call upon our speaker for his oration.
Good evening. Am I audible? Good evening, one and all. Respected dignitaries, President Gopal Krishna sir, General Secretary Durga Prasad sir, and Anand sir, and other members of HMAT. I am very much thankful to all the members who are attending this seminar. I am attached with this HMAT from 2009. I was attached with this HMAT. Just I will give a brief introduction what I know regarding this association. I think this is the only association in India which will conduct seminar every month for the doctors physically by having this type of meetings. Generally, associations, so many associations are there, like other associations. But in turn, this is the active association, what I feel personally. It may be wrong also. And I'm very much thankful to my sir, Dr. Mohan sir, J.R. Mohan sir, and Gopal Krishna sir, and Janardhan Reddy sir, and Shivashankar sir. They gave me an opportunity to work as a senior research fellow in an EMR project here. And I did my work during that time. And I learned many things from the physicians who are working here, from Saraswati madam, Rajeshri madam. There are so many people. I used to have a lot of discussion with them. And at the same time, there are so many people who are working hard to have this type of academic work, like publishing journals every month. It's not an easy task. See, even in academic institutions, which are having certain protocols and bounded work, still we are unable to publish certain journals. But here, there are few people who are collaborating and contributing, and they are doing their work without, sometimes I can say, without recognition, and they are putting their efforts for the sake of homeopathy. So I sometimes I feel that I'm not doing my efforts to this place where I work. Okay, next time. That means when chances come, that means personally, I have a little bit emotional attachment with this institution because I learned many things here. And I'm able to stand here because of there is some role of this institution, association. Okay. Thank you for giving me this opportunity. Okay, today my topic, pediatric cases, precedents in homeopathy. The figure, the first type, the intro figure itself indicates Hahnemann and the books, what he wrote and the main principle of homeopathy. In this presentation, I give introduction. This is my index. Just you can see, this is my timetable. You can say 45 minutes. My presentation will be. So why I selected this topic, pediatric cases and its importance and role of homeopathy in pediatrics. So pediatrics is a group. That means there are so many types of approaches. We can say homeopathy, allopathy, Ayurveda, Ayush systems and other systems. But as a system, homeopathy, we have an opportunity and advantage, we can say, over other systems in treating pediatric cases, particularly. Because if you see, next slide. So if you see the innocent faces of infants or children, we feel a lot of enjoyment. That gives a lot of pleasure. Is it right or wrong? So when you want to say about your joyful moments or beautiful moments of our life, means definitely we remember our childhood days. We never say about our adolescent days or younger age. Usually everybody says, I was very happy when I was studying in that school or that college, like that. So that is the attachment of a person with his childhood. In an interview or in a promotional event of RRR, there is a movie, I think you know RRR. In that promotional event, one journalist asked a question to Rajamoli. Do you make films for adults? That means larger section are there, or you make for kids? Then he told, I make films for kids in adults. That means we have kids in our mind. That is the thing. Knowingly or unknowingly, we are attached with our emotions or kids. So a kid is suffering means every family, that entire family suffers. So even the relatives suffers. So if you are able to treat a kid means you are getting a lot of impression from all the section of that family. So handling pediatric cases is more important and it should be, I can say, cautious. Because this is the age group where, next slide. Next slide. The best way to make children good is to make them happy. Okay. How we can make them happy, that I will show in the last slide. Okay. So this is the thing you should remember, how you can make them happy. So what is the group? Going to the topic proper, pediatric age group includes first day of the birth to 18 years as per pediatrics side. Here, toddler, 13 months to 2 years. Infants, I forgot to mention infants, and early childhood, 2 to 5 years, children, middle childhood, 6 to 11 years, early adolescence, 12 to 18 years. So coming to the homeopathy, why I selected this topic, how homeopathy can help in these type of cases means, if we see the susceptibility, see, I'm not saying any theory or concept. What I practice in my clinic, what I feel, what I learn in homeopathy, I'm saying. Okay. There is no, even I can say it may be 1% or 2% additions or deletions, because there is a saying that homeopaths, we use more adjectives rather than verbs. Okay. I did miracle, the cure is wonderful, like that. But I'm not saying about any miracle. This is the results of homeopathy. If any failure is there, that is of Murali. If it is success is there, means that is the success of homeopathy. Okay. I generally follow all these steps in my clinic, knowingly or unknowingly. because this is the thing what we learned in our undergraduate and postgraduate. So here, why I'm saying susceptibility means the kids or infants, as per age, as age increases, susceptibility decreases. And pathological changes or deteriorations or additions happens. So that susceptibility decreases. So here, the pediatric group is like a fresh case. You can handle that means symptoms will be very clear cut. So that is the advantage of pediatrics. But in case of adults, it may or may not be there. It depends upon the physician's talent or his capacity to tackle a case. Next, generally pediatric cases, parents nowadays are even in they are refusing to give antibiotics for longer duration. Even if you see the parents or relatives, generally they come to homeopaths, sir, my kid is not taking allopathic medicines or syrups because 1 day, 2 day he can take. But after 1 week, he refused to take because after this type of medication, he may have some gastric disturbances or some health disturbances which he cannot express. Adult can feel that, sir, my stomach is burning or I'm having distension of abdomen, some problems, constipation or weakness, something he can say. But a kid cannot say or a child cannot express his sufferings. Then homeo medicines, they're easily palatable, acceptable by the pediatric because our medicines, they're sweet pills, and definitely most of the kids, they come to clinic because for that pills only, because it is easy to consume. And if you are able to give the right remedy, they will get relief within a short spell. Next, there is a myth and fact. What is the myth and fact regarding? There are so many myths regarding homeopathy. In that, one among them is homeopaths, generally we take a long case. We have a lot of discussion with patients and we counsel them directly or indirectly. So many argue that you are giving placebo only. Because of your counseling, you are able to give relief to the chronic patients or acute patients. But if you see a pediatric case where child cannot or a kid cannot have a rapport interaction with the physician, is it right or wrong? He will not have any interaction. So here we are giving medicine basing on the functional symptoms or pathological changes or any symptom. We will have less time and there will be less interaction and there should be more accuracy while giving the treatment to pediatric cases. And only thing what we have to remember is result should be, that means treatment should be, or the positive result should be very quick. Then only we are accepted by the society. Definitely you can say, if anybody argues, we are 2 months back, when I was having discussion with an allopathic doctor, he reluctantly said that, sir, there are so many articles that homeopathy is a placebo. Then I told, sir, if it is placebo, even allopaths can give homeopathy medicine. No, why you have to charge the patients? Is it right or wrong? Why you have to take so many scannings, reports, all those things? You can give placebo to everybody. Those who are not getting relief, then you can go for allopathic medicine. So it is not that thing, but here we are answerable to the scientific society. Okay, that is evidence-based medicine. Next, in this regard, I want to tell about a few points regarding thoughts on classical homeopathy written by Dr. George Vithelkas. In his preface, he wrote, please, I follow almost different type of books. This is one book which I'm fan with. I studied this book in my UG 3rd year. So this was the book where he mentions clearly, though he is a great homeopathic doctor, he follows classical homeopathy. In introduction, he says these points. See, you give him that means in a pneumonia case or in severe acute cases, if you are unable to give relief within 24 hours, don't hesitate to send him to an allopathic doctor. Even you are a homeopathic doctor, you are unable to give relief to that boy or kid within 24 hours. Suppose, for example, pneumonia. Its pathology is serious or it may progress. After progression and destruction, that changes may remain or sometimes it may take long time to recover. So in that he says that I will try, even I will follow this thing 24 to maximum 48 hours. If I'm not feeling better, then definitely I will refer that patient to an allopathic doctor, or otherwise I will advise the patient to take other consultation or other homeopathic doctor. There is no nothing hypocrisy in that. So here, sometimes in acute cases, there is chance of changing the medicine, because even in organ of medicine, what Hahnemann says, you can feel the relief of a patient within few hours if you are able to give the right remedy. Okay, it may be in any plane. That is the judgment what we can feel. Next, as per Hahnemann's classification, there is a, so this is also practical part, not theoretical part. Please try to understand. If you see the diseases, I selected these diseases now, today's topic. Chronic diseases, diseases with few symptoms, and local diseases. Here there are two things. One is surgical and the other is non-surgical. Okay, today I'm going to deal with surgical type of cases. Okay. There are true surgical is different, chronic, few symptoms, local diseases with surgery. That is different. Surgery is, surgical cases means you cannot do anything. As homeopaths, we have to give palliation, or sometimes we have to assist them in treating the type of cases. Here, chronic diseases only with few symptoms, and local diseases where again two, non-surgical, surgical. Today, I will deal with the 4 cases where they are surgical. This is a case of a girl, 3 years old. She came to me on 21/2019, swelling below tongue, no pain or other symptoms. Our parents came for consultation because while eating something, there is, she is saying, "Nakedo addupadta undi," ingetappudu. That is her complaint. There is no symptoms at all. Then I examined her. This is the condition. In the ventral part of the tongue, in the center, there is a soft projection like a pea size. Okay, there is a soft, are you able to see? Soft projection. Probably my mobile is not that much clear, so that photo may be not be that much clear. Please, that is a small pea size growth in the center of that ventral part of the tongue. So what, when they consulted pediatrician, he told better to have surgery. Better to have surgery. One more thing, these are all normal cases. Okay, don't feel that these are wonderful cases or anything. There are so many wonderful cases treated by homeopaths in other sectors. So here the complaint is a mass-like sensation where person, that kid is unable to, sometimes feeling difficult, not difficult in swallowing, that sensation. Then I repertorized Kent repertory. Generally, I prefer Kent repertory or Pathak repertory, sometimes Boric repertory. Though I have software, Jomeo. Here, mouth, swelling, tongue, painless. Mouth, swelling, tongue, painless. Welcome you, sir. So here, mouth, swelling, tongue, painless. Meserium is the drug. Only one drug is there, meserium. Here, then retrospective questioning. I asked her whether you have any treatment history for this kid. Then her father told, sir, 6 months back, she had some eruptions on the scalp. Some eruptions on the scalp that was treated by ointment. The eruptions on scalp, pustular eruptions, that was treated by external applications. That was, I thought that is suppression of external that eruption, pustular eruptions. So what is the meserium? Meserium, one of the important drug for pustular eruptions of the scalp, where painful eruptions you can feel. So I gave her meserium 200, 1 dose on 21/2019. There is no marked change. Then meserium 200, 1 dose on 4/2/2019. Change in the size. Slowly, she is not feeling that sensation. Either nalikkinda unnattu and a sensation, she is losing that sensation. Then after 1 month, roughly, sulfur 200, 1 dose was given because of, as I felt that there is suppression, history of suppression of eruptions, as it is it should be followed by an anti-psoric drug. I gave sulfur 200, 1 dose. So these are the 3 doses I have given to her. Meserium 200, 1, 2, then sulfur 200. Why 200 means, in any doubtful cases, don't go for high potencies. That is my experience or what I learned. Okay. When you are confident, you can go for high potencies and you can stay on high potencies for long duration. When you are in doubt, you should have more stones. When you are perfect, you can have only 1 hit. Next, this is after meserium 200 and sulfur. With 3 doses, or that is called mucocele of tongue. What is it? Mucocele of tongue. Actually, I don't know the diagnosis also, basing on that, because what Hahnemann says, diagnosing of particular condition gives value for particular symptoms and more PQRS symptoms. Even without diagnosing also, if you are sure short of your symptoms, then you can go with the case. So many homeopaths, we give medicine mostly without diagnosis many times. Then second case, a baby girl, 3 months, that's a neonate, we can say. Old, then she consulted me on 10/11/2020. I find this wrong address. Swelling in umbilical area, no pain, otherwise apparently healthy. There is a swelling in the umbilical area. History of diarrhea 10 days back, and she used allopathic medicines. As she generally gynecologist, pediatrician, they are the good combination. So after gynecology, they will consult pediatrician, and they will be side by side. So they consult the allopathic doctor. He suggested, okay, we will wait for a few days, because after that means removing that umbilical connection, that will remain for few days in some kids. So this is the condition, umbilical granuloma, umbilical granuloma. Here, in this case, they consulted me because their parents are in touch with me. They use homeopathic medicines. They don't want to go for what the doctor told. It may subside automatically, but the time limit should be within 5 to 7 days or maximum 10 days. So they waited up to 2 weeks. That is not reducing, and she is feeling, we can say, irritable, and she is crying, all those things. Because of that, she may be feeling pain also, we don't know. So they consulted me, sir, can you do anything regarding this case? Then I was not confident, but I thought that homeopathy definitely have some scope in these type of cases. So I took case, then I inquired the thing, anything that happened previously. Then mother told, sir, she had diarrhea 10 days back and suppressed because they have given some medication, IV fluids, all those things, that is suppressed. After that, she developed this condition. So for this, generally, when in my clinic, when I have doubt, any suppression, in Kent repertory, in Kent Metro Medica, if you read Antimonum crudum, it gives so many different varieties of metastasis. Okay, please go through, if you find time, please go through Antimonum crudum of Kent's Metro Medica. So he gives metastasis from one organ to other organ. probably he mentions allopathic doctor, they will not understand these type of metastasis because they are particular about their particulars. Kent repertory, generality, metastasis. What is the most frequently indicated drug is abiraterone, next followed by pulsatilla. Okay, when there is particular generals are available, you can think of pulsatilla. If you don't know anything, you are in dark, you think of abiraterone. There are so many drugs like carbo-vegetabilis, sulfur, abiraterone, and pulsatilla. As per my knowledge, these are the 4 top grade drugs for metastasis of any complaint. Suppression of skin, they are getting GAT complaint. Suppression of any complaints. If you are in doubt of beginning a case, that it may be suppression, then you can think of abiraterone, pulsatilla, carbo-vegetabilis, sulfur. I hope Kali Carb is also there. So here I have given abiraterone 201 dose on 10, 11, 20 and 15, 11, 20. Why I repeated the dose though I'm confident? Here abiraterone is not the simillimum. Okay. Abiraterone is selected basing on the okay. So here abiraterone is not the simillimum to that patient. Here it is given basing on the, we can say, causative age or not pathological. Here only metastasis. And I'm not sure that this abiraterone is the right remedy. So that only I repeated, but I waited because if I give any remedy or if any homeopath give remedy, better to wait for few days if that is not a serious case. Okay, then 10, 11, then 15, 11. Swelling decreased automatically, and here there is no external application or anything. Only thing is they used Dettol for cleaning that granulome. So this is the after treatment, slowly receded back after abiraterone. And I have not given, there is no other remedy in this case. You may ask, in previous remedy, you have given sulfur, here there is no sulfur, means I have given in previous case sulfur because of there is history of eruptions. And as this case is automatically reduced with this abiraterone, so I thought that this is pure suppression, no need of antisoric here. Then next, a case, a third case, a boy is aged 4 years. There is swelling or pedunculated growth below the tongue in ventral part. No pain while eating food. There is some discomfort. He is lean, active. We can say thermals, a little bit hot patient. Desires fanning, cold bathing, or normal bathing, and desires non-veg, salt, fanning. I gave natrum mur 200, 1M, Tuja 200, 1M, only one dose. Here, natrum mur 200, why I selected means, if you see the Kent's repertory, Kent repertory, mouth, swelling, tongue, painless, natrum mur is the drug. Single drug. Single drug, natrum mur. Okay, painless, swelling, tongue, below the tongue. Above the tongue or overall the tongue, meserium. Okay. Here painless is, natrum mur is painless and painful. Painless, that is also one drug. Painful also one drug. Okay, please you can verify it in Kent's repertory. So here I have given natrum mur 200. After gap I gave again repeated natrum mur 200, then 1M followed by Tuja 200 and 1M 1 dose. So this is the growth condition. Actually, I don't know the exact diagnosis of this case, and even they have not consulted allopathic doctor. Just over the phone, they spoke to that allopathic doctor. He said, you can come to here so that we can remove that growth. And father, he is a ardent follower of homeopath. So he said that I will wait for few months. So I asked 3 months time. Okay, if you are able to, because in some cases, we have to ask time. We are not short of these type of cases because sometimes they will, here natrum mur is not the simillimum. Kent repertory, mouth, swelling, tongue, painless. after treatment. You see the second, this is the first before treatment and after treatment, second figure. Next, fourth case. A boy aged 4 years. What is his complaint means? Hoarseness of voice, difficulty in breathing, cough, aggravated by lying down, rattling sounds, desires cold drinks, chocolates, sweets, and all. This case is I can say, a special case to me because I got this case from an allopathic doctor, ENT hospital, Koti. Okay. I don't know how he got my number, but he called me and he told that, sir, I want to send this case to you. Somebody told your name like that. And actually they stay in Dammai Guda. And I practice in Dilshuk Nagar. Okay. Here, when the patients or parents approached me, that case is a recurrent laryngeal papilloma, rare case. Okay. Papillomas in the larynx area, vocal cords area, below and above. He has to be operated every 1 week or 15 days. Recurrent laryngeal papilloma. Surgery once in 10 days. Sometimes it may go once in a week. So here, basically, in that case, I was not confident because patients are in anxious mode. Sir, మా వాడికి తగ్గాలి సార్ ఇది, because they are financially, for one operation it takes 20 to 25,000. You imagine for 3 operations it will cost 75,000. It is not the matter of money, it is matter of the mental torture what parents are having. That is more important in this type of case, because if you are able to treat a sinus case, they can go for operation also. Probably it may cost 50,000. But if you are able to treat with homeopathic medicines, it may cost 1,000 rupees or 2,000. See here, you are reducing the economical burden and hospitalization, mental torture, physical work, burden, all those things. That is the beauty of homeopathy, we can say. So here, remedies, I repetized the case. Argentum nitricum, antium tar 200, phosphorus 200, 1M, causticum 1M. These were the remedies I given to this patient, because here the patient comes, he comes with a lot of the parents. Sir, ma vadiki taggaledu, meer taggichali. Literally one day I told, please, I can't bear this pressure. Please, meer ekkadikani vellipondi ani cheppanu vallaki. Because when I'm unable to help them, they are coming from such a long distance and they are waiting for us, means for my mind, I not accepted this type of cases. So I advised them, please, you go. No, he said, sir, sir, meeke chepparu annadu. Sare, meer ataithe naaku koncham time ivalandi. If you are able to give some time, I will try my best. Like that, I told, and already they consulted a few homeopathic doctors, renowned homeopathic doctors, and they came to me. So I took, please don't give a lot of pressure to me. I will try to find good remedy. Then this is the case, laryngeal papilloma. Are you able to see? So actually this single case can be dealt for half an hour, because this is a long case. We can deal in a good way by repetizing all those things. This is the report given by, this is after surgery. You can see the date also. 2020, 13th January, there is no laryngeal papilloma. Okay. This is my, you may not believe, so that I'm keeping my clinic case sheet here. So annihilinum, MIR, you can see causticum. Causticum, antium tart. Why I selected causticum, argentum nitricum, phosphorus, causticum, all those drugs means, first I started with argentum nitricum. So here, the condition is pathological, rapidly growing, and the physician is not sure short of his semilimum. That is my condition. So no, I cannot take. So I have to take, probably I don't know. So I started repeating the dose. I generally, I will not repeat the dose, but in this case, because of hurry, pressure from parent side, I repeated the remedy, argentum nitricum. You take morning, evening, SL, or morning, evening, 3 days. Like that, I follow different method, but there is no improvement. Then I thought that it may be a case of phosphorus. Then I gave phosphorus, 200 1M. There is no improvement at all. Then affinity of vocal cords and larynx. Then again, argentum metallicum, argentum nitricum. In these two, argentum nitricum is chill, warmth patient. Then while talking with mother and father, affinity and hoarseness of voice, rattling. Here, I have video of that boy also. When he sleeps, yes, rattling respiration, he is unable to expectorate it. ఆ సౌండ్ వచ్చినప్పుడు వాళ్ళ పేరెంట్స్ దే ఫియర్ అండ్ దే ఇమీడియట్లీ దే గో టు సర్జరీ. And that hospital is also far from his place. Then automatically there will be a lot of pressure from parents, so that again they will come to an homeopathic doctor. So first they underwent surgery in August 2014. Then they consulted me on 15/7/15. So after 6 months or 1 year, we can say. Then after starting my treatment, next surgery is 24/8/15. Next surgery is 22/9/15. That means almost 1 month gap. Then 12/10/15, almost 20 days gap. Then followed by 4/11/15. Then again 20 days gap. Next 3/12/16 after causticum. Okay, when I gave causticum, the gap increased. So causticum 1M, first 200 daily 1 dose. If they have any rattling respiration, then antimutant. Generally, I don't give like this, but in that case, there is, as I was not having option, as I remembered Vitalka's statement that in this type of case, you can try. So I was asking which medicine you are feeling. When they say that when I give antimutant, rattling respiration is decreasing, but in total, he is feeling better. So in acute phase, I am giving antimutant. In chronic case, I'm going for causticum. So 4/11/15, then 3/12/16, almost 3 months. Then 4/6/16, almost 4 months. Then 22/1/18, 1.5 year. Then followed by 16/8/19, 1.5 year. Then till now, there is no laryngeal papilloma or anything. And he got, now he will come regularly to my clinic. Is very good. Still, there is no, and he did so many tests, human papilloma virus, this test, that test, so many tests are there. This is the case of a recurrent laryngeal papilloma. So here, as a homeopath, we reduced their financial burden, their mental torture, pressure, and kid is feeling, we made him happy. Because when a kid is not healthy, he will not be happy. When a kid is not happy, when kid is healthy, he will be happy. When he is happy, everybody will be happy in their family. So as a homeopath, we should not work on treatment part only. We should give some advices as a preventive aspect, advise patients, because as we are enjoying today's life, as we should consider future of new generation also, we should advise regularly to patients to reduce the usage of plastic or something. There are so many things, whatever as per your knowledge, you go with that. So try to reduce, not giving medicine. Giving medicines is one part of treatment. So avoiding the disease is most important. The best physician is who gives more placebo or who gives less medicine. Maintenance of good quality of food and water, cautious about polluting agents. Please advise them in your clinic. Take time or spend some time to advise these things. Because nowadays, even hot tea, it is packed in these polythene bags, and food, everything, and we are giving medicines. Definitely it will help, but if you are avoiding, that is better than giving medicines. Okay. Next, homeopathy is equals to health, that equals to happiness. If you want to make happy, you should make health, then with homeopathy. Okay. Thank you. If you have any doubt regarding any case or anything, I can answer. Any doubts or if you want any clarification regarding these 4 cases? Thank you. Yeah, umbilical hernia, maximonica. Yes. That is that. Yes, ma'am. Abdomen is specific ability towards umbilical. Any discharge or any hernia or any pain in umbilical area, we can think of abdomen. Yes. That was my, I think, unknowingly I was having that idea. A hospital that helped me, and after this case, 4 cases I got from VND hospital regarding recurrent laryngeal papilloma. Okay. All cases removed, but only thing is, if they give food follow, we can have some our best efforts. Otherwise, it is very difficult because they have here growth will be very fast and technique will be in early mode. They want relief immediately, that which is not possible until we give the right way. Thank you.
Thank you so much, sir, for your knowledgeable session on pediatric cases and their precedence of homeopathy. Now I call upon our Vice President, Dr. Anand Rao, sir, to introduce the speaker of Dr. D. Lakshminarayan Memorial Oration, Dr. A.M. Reddy, sir. Please welcome, sir, with a round of applause.
Good evening, all. I take pleasure to introduce today's second speaker, my good friend, Dr. Ambati Mahesh Reddy, popularly known as Dr. A.M. Reddy. Dr. A.M. Reddy is a renowned homeopathic physician in South India, and he is a passionate entrepreneur in the Indian health sector. He graduated from HKE's Homeopathic Medical College, Gulbarga, and post-graduation from Bhagwan Buddha Homeopathic Medical College. Dr. A.M. Reddy established a chain of homeopathic clinics, successfully expanding his clinics across Telangana, Andhra Pradesh, Karnataka, and Tamil Nadu, with each branch contributing to the positive transformation of healthcare delivery through homeopathy. His network of healthcare ventures include Dr. A.M. Reddy Autism Center and Dr. Care Homeopathy under Dr. Positive Health Sciences Private Limited, for which he is the director and the founder. With Dr. Positive Health Sciences, he pioneered specialized treatment approaches for autism spectrum disorder and other personality disorders, utilizing innovative homeopathic immunotherapy to achieve remarkable outcomes. Recognized as pioneer in treatment of autism spectrum disorder using homeopathy, Dr. A.M. Reddy established more than 50 branches of Doctor Care homeopathic clinics across South India and is honored with the Best Doctors Award in 2013 and with Forbes Iconic Achievers Award and also the UK Parliament Award in 2021. I request Dr. A.M. Reddy for the next lecture. Thank you.
I can't change it. Okay. 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 Good evening, everybody. I'm very much happy to came here and giving about my experience. Totally whatever I'm giving, I'm experience, it is a totally from practical experience. So there is a challenging problem. Nowadays, it is going to increase autism. Since 10 years, I am doing in autism practice. So we'll discuss today about autism and ADHD and hyperactive cases. What is the reason? What is the help of homeopathy, role of homeopathy with my experiences? Thank you. Next. Next, ma'am.
These are my endeavors since last 20 years in homeopathy. Thanks to Dr. Samuel Hahnemann, our father, my guru, Dr. Praful Vijayakar, given the thorough knowledge and single dose practice. After his knowledge only, I got success in my practice. And my first guru, Dr. K. Shivshankar Garu, I was there 1 year with him. So many things I learned from him. So whenever I came out from the college, I don't know about homeopathy. Through sir only, I learned everything. So thanks to Shivshankar sir. And Srikar Manu, I was there with Srikar Manu 8 months. So he is also one of the best, my guru. Then finally, my father, he is the initiator for joining in homeopathy. So I'm very much thankful to father. He given the breath, but now I am taking the homeopathy breath only through his loving blessings. Thank you. So now world is facing a new challenging problem, the autism. So autism is a neurological disorder affecting the communication skills, resulting in the poor social communications with the people around and the surrounding people. So it is a pure neurological disorder. It is not a disease. Why does these problems occurring? What is the reason behind of this? We will discuss in detail. The scope of allopathy, there is no medicine in modern medicine to treat these type of neurological disorders. But modern medicine is only working for diseases. But these type of disorders, there is no help. There is no hope. It is a completely hopeless situation. Even though changing the doctors, the same medicines are available. So it's better to change the system. Alternative. The scope of, there is a hope to treat constitutional way in homeopathy. The problem preferred identically below 3 years, so easily. So many factors involved into the health conditions of the parents, which is affecting in fertilization process. The healthy parents, healthy fertilization, those the healthy pregnancy, there is no chance to come these type of neurological disorders. The parents' health is the perfect. There is no chance to come these type of neurological disorders. It is not a genetically. All diseases are only coming from genetically. It is not a disease. It is a disorder, disturbances in the health conditions of the parents. So in my practical experience, the main reason of autism and ADHD and hyperactive cases, the disturbed and polluted constitutions are developing through ovulation process. So disturbed means sperm quality disturbances, ovulation process disturbances, ovulation processes disturbances. So disturbed constitutions means millions of sperms is attacking to ovum. So that the speed of the worm, everything is indication disturbance of the parent health conditions. So azoospermia cases of azoospermia, oligospermia, who is taking medicines for these type of disorders, PCOS and PCOD, complaints of the mother, hormone disturbances, and thyroid and other parents, whether father or mother before the pregnancy, and diabetes, either parents, before and after this one, anemic conditions of the mother before and this one. Nowadays, anemic conditions are the common. So with anemic conditions, suppose the anemic condition lady is there. So these are the disturbed ovulation process. It may affecting to hyperactive, it may affecting to ADHD, it may affecting to autism. Depend on the disturbances, depend on the constitutional production. And usage of oral contraceptive pills also disturbing the hormone system. That is also one of the major reasons. Frequent urinary tract infections before and during pregnancy, because the continued infection is there in the body. The same infection, we are using medicines, we are suppressing. Again, the carrying infection, again, it is coming out. Frequent abortions. So abortions is the not natural process. Abortion means something disturbances into the healthy conditions of the mother. Even father's sperm quality is also disturbed, it causes to abortion, not only mother. Father's sperm quality is also disturbing, it is also leads to abortion. So disturbances of the health conditions of the parents, hormone disturbances, whatever may be. Antibiotics just before pregnancy taken. Unknowingly, some patients are taking antibiotics without knowing this one. Then after 1 week or 2 weeks, they have got to know the pregnant. That is also because ovulation process, neurological system started, nervous system started initial days only, and early stages of the pregnancy. Ointments who used for suppressing skin infections, that is also disturbing sperm quality and ovum quality. Gestational diabetes, gestational thyroid problem, gestational hypertension and hypotension. Used hormone pills in first trimester to maintain the pregnancy, risk pregnancy. Risk pregnancy. Nowadays, allopathy doctors are easy to prescribe, but they want to maintain the pregnancy. Then they don't want to see these type of neurological disorders. Anxiety, psychological disorders, hypertension gravidarum, and medicated pregnancy. Who is using medicines forcefully for getting pregnancy? That is also not a reason for this. Vaccination during pregnancy. That is also means that vaccination is also affecting the disturbances in ovulation process. Excessive alcohol, tobacco intake during pregnancy, early pregnancy. Early pregnancy means after first delivery, within 6 months to 8 months, again they got pregnant. During feeding time, they are getting pregnant. So this is the means hormone system is not at least 2 years minimum to give gap one pregnancy to next pregnancy. The early pregnancy is also one of the reason. Usage of constant usage of anti-epileptic pills before pregnancy, father, even mother, and psychiatry medicines, anti-allergy medicines. These are also responsible quality of ovulation process. The over vaccination, double vaccination, also child. These are the triggering factors. Previously, we discussed about the causative factors. Now the triggers, whatever the causative factors, these are the triggering factors. Double vaccination, over vaccination. 15 to 20 vaccines we were supposed to give in 3 years of child. Now 50 vaccines we are giving. Overloaded of vaccine. Excessive usage of antibiotics for acute infections. Nowadays, parents are very much worrying with single child because of insecurity. They are using more medicines. They are not giving time in 2 days also. Hurriedly, they are using antibiotics for all acute infections. All acute suppressions only that leads to chronic problems. Why chronic problems are coming? Why chronic problems are nowadays suffering? So we suppressed all acute infections. It leads to chronic problem. If you are not suppressing acute problem, the body itself heals. Otherwise, homeopathy is helping for healing process. Excessive skin suppressions, excessive usage of steroids and medications. So with my experience, hyperactive is the base reason for all this one. Hyperactive means restlessness. The base reason. Without restlessness, there is no autism. Without restlessness, there is no ADHD. When the restlessness is there, it starts with physically, then it leads to mind. It goes to mind. So after hyperactivity, attention deficiency disorder comes. After attention deficiency, autism develops. So in autism, mild, moderate, severe. Even ADHD is also mild, moderate, severe. Hyperactivity is also severe hyperactivity, medium hyperactivity. You can give a classification. So one case presentation is there. A case of Master Allen. Master Allen is not a real name. We duplicated the name. A child is 10 years, visited my branch. Doctor taken the case. The case is Down syndrome case. We'll show the video first. Video. The case. Video presentation. First video. Is so much of suffering, this child. Down syndrome, psoriasis, and mild autism. These are suffering. Down syndrome is totally, it is a genetically related. It is a carrying from genetics. And autism is a leading with the disturbances of more medications. And physical problem is the psoriasis. The child is suffering with psoriasis. What more? Video case is there? Can I? This is the condition. These are the scale, excessive scale formation of the child, 10 years of child. Chief complaint is the skin and some losses of focus of speech is also delay. There is a severe itching aggravated after taking spicy food. After mental, emotional triggering factors like anger, mind symptoms were taken by the doctor. Child is would be always play alone. Self-talking is there. Attention deficiency is there. He was reported obstinate and jealousy patient. Jealousy is there. He enjoyed watching violent fighting scenes in the movies. There is a violent in mind. The reading was one of his favorite passion time. Desire for reading, looking for reading. He's also enjoyed music. Fear found of some loud sounds and bright lights. Poor sitting tolerance because of restless. He would be always want to throw things around, creating some mess because of anger and irritability. Observe the spinning things constantly. Why observe the spinning things constantly, autism patients? Because these mental restless is connecting to moving things. That's why they travel more. That's why this fan, they see the fan because connecting. That's why they love the music. Music is a changing. Mind is a changing. Because of restless, they connect easily with moving things. One of the most important points taken consideration when they're taking time child is the parents is the health conditions before and during this one hyperactive. In this case, the maintain the health issues that came during the pregnancy history. Mother, she had some spotting in the first trimester and hormone pills, injections taken, given, maintain the risk pregnancy. Through the both parents are fairly young, they are conceived with the child at the age of 26 and 32 years of the father. Mother is 26. With this unnecessary disturbed with these hormones. The child is delivered with 3 kg. When the child is a couple of months old, they develop the skin rashes. Parents used medicines and soaps, ointments for this one suppression. And milestones were reported achieved while walking and starting late 2 years of this one. He had an episode of high fever, high grade of fever with severe diarrhea, used antibiotics, 15 to 20 days. Daily regression, eye contact. Then after that, the patient is suffered with regression. Stability is also disturbed. The frequent episodes of cold fevers, after that frequent episodes are getting this one. They decided to taking homeopathy after notice this decline child immunity. Startling is there, delusions of the animals, because he passionate, he is love for animals. Gestures, hands always on genitals. Canine hunger, jealousy, photophobia is there. Tossing in the bed always because night aggravations. Love for animals. The mild Down syndrome, psoriasis and ADHD. This is our diagnosis. First prescription, Sorinum I given because of highly chilly patient, restless, skin problem. Sorinum is also medicine for restlessness. Sorinum is also medicine for offensiveness of skin. First to follow up child back to month, psoriasis, eruption spreading overall worse. It is the condition is worst. After 15 days, the condition is very much aggravated because previously they suppressed psoriasis. Everything is came out. This is the original picture. Previous rubrics taken the consideration along with this one, burning and scaling pains. Child history of urine infection is there. That also used medicines. They said, I decided to change the medication. The first follow-up is so much improved after given constitutional medicine. What is the constitutional medicine? Anybody? What is the meaning of constitutional medicine? Which is a single medicine or any other? Anybody? Yes. 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 The constitutional medicine. Constitutional medicine is the which is a working under according to Herring law. That is your constitutional medicine. Herring law of cures. Better, stronger miasm to better miasm, whatever may be. Better side, better side. So constitutional means according to Herring law, better side. That is a constitutional medicine. We have to observe the patient better side. That may be nearer medicine also. If it is a better, that is a constitutional. Constitutional is, it is coming down from higher miasm to lower miasm, center to periphery, major organ to minor organ, whatever may be. Your medicine is working constitutional way. Not only single medicine. Your constitution may be different, my constitution may be, your constitutional medicine may be different, my constitution may be different. But your constitutional medicine, according to working Herring law, my constitutional medicine also according to working Herring law, it is a right. Okay. So it is not only single medicine. Constitution means not only single. Don't try for single. Center to periphery. Herring law, according to Herring law, which is the better side. It may be nearer also, it may be exact also, but according to Herring law, if it is a working, it is a constitutional medicine. Constitution we are treating through better side, according to Herring law. Okay. So second follow-up, he is very much improved. Head is also almost better, hands is also almost better. Third follow-up, he is so much improved. Video presentation is there. Okay. So for this case, mother is suffered a lot, 3 problems, not only autism, not only ADHD, not only Down syndrome, not only psoriasis. All problems are the diseases. See how the mothers are suffering. So I given medicine. Chilli patient, I taken animal kingdom because night aggravations, hands on genitals, psoriasis, aggravation at night. First one, worst condition you can show, then next you can show. Yes, this is the worst condition. Even totally scales in the chair. So much of offensive. Simple. I taken restlessness. I taken psoriasis. I taken animal kingdom. I taken just hands on genitals, frequently touching. Chilli. Suppressed urinary tract infections. I given Cantharis. Only 1 dose. Only 1 dose. Not that repeated now also. So after 2 weeks only is better. Cold cough also came out after 1 month. Not taken any medicine. In 3 months, the total psoriasis, even attention also better. Down syndrome, we can't treat. It is not so easy to treat also because genetics are not going to support. Attention problem is better. Psoriasis is better. Healthy conditions of the patient is the better. Everything is better with this patient. Cantharis 10 mg, only 1 dose I given. Cantharis is basically acute medicine. If I will give 1 mg, I want to repeat again. So I don't want to repeat. Only 1 dose. Generally, I will give for cases 200 potency 1 mg only. For this case, I given directly 10 mg 1 dose. Previously, Sorinum given. After Sorinum also, I given calcarea floor. Not at all improved. So finally, I came to this is an animal kingdom drug. This is a chilli drug. Frequent urinary tract infections history is there. Hands on genitals is there. So this is the case. Okay. Okay, this way. I'm always feel proud as a homeopath. Totally 300 doctors working under my organization. 50 lakh rupees I am giving salary for them. It is not my great job, because of great system I am in. Because of Shivshankar sir, because of Srikhar Manu, because of my seniors, Dr. Gupta, one of my initiator, Anand sir. If I am not studied in Gulbarga, if I am not roaming with Gulbarga seniors and friends, I may not practice homeopathy also. Maybe, I don't know. So luckily, I am coming from Gulbarga College. I am always thanks to my college, seniors and everybody. These are the challenging problems. I taken the challenging role in homeopathy autism. As Anandana telling, I am an entrepreneur. Yes, entrepreneurs are always challenging, tough jobs. When I started my practice at 2000 with Gupta Anna, I also went to Gupta Anna. He's saying, I started same way in pharmacy. Krishna Sai Homeo Stores and Clinic is my first name. After that, I went to Shivshankar sir. I taken knowledge, mother tinctures knowledge, biochemical knowledge, and multi-dose practice also I successfully did. Then I attended Vijay sir seminar. Then I came to know, so this is the right way. This is the royal way. This is a single dose practice is the right path. So many youngsters are not believing homeopathy nowadays. This is a bad luck for homeopathy. Then I immediately, within 3 months, I turned into the single dose practice. Then I started after 3 years. I went to Dr. Srikhar Manu for 8 months. He is also very knowledgeable and given good knowledge. I am very much thankful to Srikhar Manu sir. Then I associated with Dr. Kiran. He is also a very good person. Now I am enjoying with Dr. Kiran Homeopathy with 800 employees. So homeopathy is a very beautiful system, wonderful system, scientific system. Even allopathic doctors can't get this type of enjoyment in practice. They are getting bored, So many allopathic doctors are getting diabetes, getting problems because of getting animal practice. Prescription is the same. There is no teasing. There is no enjoying. So we are the great homeopathy. From Hanuman to here, from Vijay sir to here. So we are the responsible for future. You are the responsible. Youngsters are the responsible for future. Try to find out your constitution first. Then only you are an eligible homeopathy practitioner. Otherwise, you are a only certified practitioner. Try to find out your constitution. Try to find out your health conditions. Then your family. Try to find out your family. Then you are eligible to see the patients. I follow the same. I am the practical person. My weakness is I am not a liar. I can tell everything to open. That is my success. I feel always homeopathy is the great science who have to develop. Mother is important. If mother is good, if mother is spreading a lot, we will get a good practice, good business, good employment. There is a scope. Even though all my 50 branches, single dose practice only my doctors are doing. No mother tinctures, no biochemics. Constitutional. We are giving trainings for doctors. So many difficulties we faced as a corporate, Guptana also. We faced so many difficulties, jobs and responsibilities for employment. It is not so easy. Even single clinic maintenance is so difficult. As a through homeopathy, because we are the mind readers. That is the advantage. This is any other medical system also not going to support. So youngsters, you are the future leaders. You are the responsible for future society. By 2030, we want to make a best alternative system. Allopathy is our competitor. Allopathy is our source generator. Source generator. If allopathy is not there, there is no scope for much homeopathy. There is no medicine. There is no need of, your system is with you. We are surviving complications of this one. So there is a lot of scope is there. There is no competition for homeopathy. So many patients. Yesterday, I taken the case, one of my employee, gastric anxiety. He is very much anxious during gastric time. After motion, he get relief. Anxiety relieved from the stools. I taken the rubric. Hypochondriasis, left side something is there in my stomach. That is also I taken rubric. I given the Caliars. Yesterday sleep etlundi? How it is? Yes. Yesterday only I given. There is a beautiness in homeopathy. Tell your symptoms.
Gastric.
Just you can tell.
Yeah. So anxiety, some like I feel very nervous and like అంటే మనకు అంటే గ్యాస్ట్రిక్ ప్రాబ్లం వచ్చినప్పుడు నేను కొంచెం బాగా టెన్షన్గా ఫీల్ అయ్యేవాడిని, బాగా ఏమవుతుందో నాకు. సో ఇప్పుడు ఎక్కువగా చూస్తున్నాం కదా, హార్ట్ అటాక్ వస్తుందేమో, అది వస్తుందేమో అని ఇంకా ప్యానిక్లోకి వెళ్ళిపోయేవాడిని. బాగా వెళ్ళిపోయి నాకు ఏమైపోతుందని ఎగ్జైట్మెంట్తో ఒక 1 అవర్ మైండ్ అంతా బ్లాక్ అయిపోయేది. ఇమ్మీడియట్గా నేను హాస్పిటల్కి వెళ్ళేవాడిని. నైట్ 1:30కి స్టార్ట్ అయిపోతే ఒక 1 అవర్ ఇమ్మీడియట్గా నేను అట్లా 4 times హాస్పిటల్కి వెళ్ళా. ఏమీ లేదు అసలు. వెళ్ళిన ప్రతిసారి డాక్టర్ వెళ్తారు, చూస్తారు, 2D ఈసీజీ అన్నీ చేస్తారు. సార్ ఎవ్రీథింగ్ ఈజ్ ఫైన్. 3-4 times నేను ఆఫ్టర్ 3 months ఐ హ్యావ్ సఫర్డ్ దిస్. Yesterday I opened my.
Yesterday you told me,
sir, this is
so much of he relieved stools. Anxiety is relieved from stools. 11 medicines are there. There is a Caliars is one medicine. This is the beautiness. This is a case taking is very much important.
Yesterday I sleep very well, sir. Thank you.
So this is the confidence. This is the important. How the doctor is giving confident medicine. Here the medicine is not important. Case taking is important. Your rough case taking, your keen case taking, your deep case taking is very much important. Then you can make some rubrics. The drug is not important. Drug not at all important. Through reportory, you have to read Mitra Medica. I learn from every patient through reportory. I read Mitra Medica through reportory only. I don't go Mitra Medica direct. If you are reading Mitra Medica, one drug picture, all symptoms appears, all drug symptoms appears. That is not a right way. It is a confused picture. If you are reading one person, all constitutions are appears. But primary symptoms are important. Dominating symptoms are important. Dispositions. What is the main position of gene? That is important. So we have to find out beautiful way. In future, we are responsible for next generation of homeopathy. By 2030 or 2040, we want to lead the great system. Even allopathy doctors also must accept in future. Nowadays, Ayush is very much developing because one of the Ayush is the world. Last time I attended the Dubai Ayush program. So successfully conducted Ayush program. This type of in future also, the Ayush is changing our medical systems through government policies, through this one. I am very much thanks to Venu Anna and Hyderabad Telangana Association members, all members, Gopal sir. I am very much thanks to each and everyone. They are selflessly diligent people. Diligent means selfless, hardworking. I am not a diligent. I am telling, according to constitution, I am developing myself. constitution to support, constitution to update you. Every person means it is not so easy also to reach their positions. So I'm very much thanks. In future, I'm also responsible to giving knowledge and development of homeopathy with my practical experience. Thanks and everybody.
Thank you so much, sir, for sharing your valuable experiences in homeopathy. Now, Dr. Janardhan Reddy, sir, will be giving a virtual summary about the seminar on autism. As sir couldn't join us physically, we will be having a virtual session, like virtual summary. In few minutes, Dr. Janardhan Reddy, sir, will be joining the online and he'll be telling about the summary of the session.
Janardhan Reddy, sir, very good evening to you. Please unmute your mic and please speak, sir.
Hello?
Sir, are you able to hear us, sir?
Hello? Hello?
We can hear you, sir. Please go ahead.
Okay. Congrats, Dr. Mahesh. You have been speaking from various aspects of autistic disorders. But basically, these artistic disorders, whether it is called autism or ADH, attention deficit syndrome, usually seen in the kids whose parents are cousins. They are blood related. This is mostly found in getting married to her own cousins or his own cousin. Also, we find nowadays where the kids are born to the parents after having IUF, like that is having pregnancy with hormonal treatment, and usually they are twins. After hormonal treatment, they usually get twins. And among these two twins, both are hyperactive. So in order to treat these kids, usually most of the kids are brought to us before third year, or at the time from second or third year or fourth year, not after or not later fifth year. So during first year, the parents may not be able to make out the condition of the kids. But as they become second and third year old, usually the kids start becoming hyperactive. They will not sit at one place. They will not be under the control of the parents. They will not have eye-to-eye contact. And they will not listen to the parents. They can't understand what the parents are saying. They behave in their own way. So that's why parents initially they can't understand unless they are literates. So they go to a doctor, usually an allopath, and then that particular doctor may say it is an autistic disorder or hyperactive disorder, attention deficit syndrome. So then gradually they go to the pediatrician and the specialist, and they can't find any relief or any sort of rather change in the kid. So these kids, especially we get mostly from the Muslim countries and also from USA, and these kids are born mostly to the non-vegetarians. The vegetarian community is less when compared to the non-vegetarian community. And to diagnose a kid is very difficult. Which remedy has to be given? Usually, in my practice, what I do is I start observing the parents. I told you most of the parents are cousins. So these cousins will have some common factors like anger, irritability, jealousy, insecurity, or some sort of fear. So some of the points are touched by Dr. Mahesh. So I look at the parents and we find glaringly some of the features of the parents. Dr. Mahesh was talking about the constitution. Constitution means mostly the temperament, likes and dislikes, and the physical features. So these are all the things. The parents' constitution will be usually helpful you to prescribe a remedy for the kids. Suppose if the mother or father or one of them is having a lot of anxiety, tension, insecurity, fear, and doubts. They don't believe you easily. They go on asking you whether my kid will be curable, and the child will be clinging on to the mother. Child cannot stay at one place, and child cannot be alone, and child will be having fear of darkness. So child is having craving for the sweets. Mother is also having craving for the sweets, or father. So in such cases, the common remedy, I tell you, in autistic disorders, there are few remedies which are frequently indicated. The most commonly indicated remedy is argentum nitricum, because the kid also manifests. If the kid were to be a boy, usually the mother's constitution will be helpful. And if the kid were to be a girl, father's constitution will be helpful to select the remedy. So you should try to pick up the nature of the kid. You must go to the nature of the parents. Suppose the father is very fatty, sweating profusely, and he has got some of the features of the calcarea car. Kid may require calcarea car. The kid were to be a girl. And if kid were to be a boy, you have to concentrate more on the mother's constitution. And sometimes mother's constitution or father's constitution may be useful irrespective of the kid's rather sex, whether the boy or girl. But there are certain glaring features. So suppose the mother is very obsessive. Mother is having fastidious nature, dictatorial nature, she will not compromise, and she's always having restlessness, anxiety, fear, yeah, always insecure. Always they will be rather focusing on their small matters, and they run to the doctor for every small ailment which is insignificant. So for such mother is there, definitely the kid requires arsenic amalgam. And also you find some kids are very aggressive in nature. So you find this aggressive nature also in the parents, either father or the mother. If the father speaks, mother says, I'm telling you, why do you bother? Why do you come in the way? So they start dictating terms to the other side. Suppose if the father is aggressive, you will not allow mother to speak. If the mother is aggressive, she will not allow to speak the father. So she's very angry, irritable, and also these people they are rather angry means not simple anger. They are violent in nature. So the kids usually most of the kids are violent. They break the furniture, they break the television, they break rather everything, whichever may be delicate. So they may throw tantrums, they may break, they may beat their head against the wall, and they may break their own heads if they are not allowed to do the things whichever they want. So the always the violent kids they require. I'm telling you, please listen carefully. Tarantula. Tarantula is a great remedy for the artistic kids having violent nature. The violent nature will be controlled within a month. So, same thing. Suppose if the mother or father were to be Nakshwamika type, you have to give Nakshwamika, sulfur type, you have to give sulfur. But I am telling you, after my 50 years of practice, most of the kids will have common features. If they are having anything very glaringly, and if the mother can tell you, this boy is particularly having a particular temperament, with which you can make out a remedy, it's well and good. Otherwise, you have to depend on the constitution of the parents and prescribe. In my practice, the most commonly indicated remedies are arsenic amalgam, argentum nitricum, antimcrude, beritacar, calcareacar, tuberculinum. Tuberculinum is very often indicated. Carcinosin is very much indicated. If you can't understand what remedy has to be given initially, because you are the doctors just now you have come out from the college, you can think of a dose of carcinosin. Carcinosin is a wonderful remedy for the kids. Most of the nosodes are helpful. If the kid sleeps on the abdomen, and if the kid craves for the sweets, and if the mother or father is having some symptoms, rather some of the constitutional features like medorinum, forgetfulness of the names of the very close relatives, you can think of medorinum. So you must always observe not only the kid, more the parents than the kid. Parental genes will be transmitted to the kids, and these kids require the definitely or usually in out of 190% of the cases, the parental constitutional remedies. So don't forget that. So whether you give single remedy or daily 3 doses for 1 week or 1 month, it doesn't make any difference. You can prescribe according to your own choice. I don't come in the way of a prescription of 1 dose or 2 doses. So you can give doses of your own choice. But you must look at the constitution of the parents in order to prescribe a remedy to the kid. I have treated one kid especially. Of course, I have treated hundreds of the kids. But out of all, one kid from the Saudi Arabia who was totally idiotic was treated with a Beretta car. Father's constitution was Calcarea car. Mother's constitution was Argentum nitricum. I have given Beretta car, Argentum nitricum, and Calcarea car. With these 3 remedies, now that particular child who is from Saudi Arabia, is standing first in the class. This is a rare case. Out of 50, years practice, one kid who was a zero, he has become hero in his life. So with these 3 rights. So you must There is no particular remedy. Only the constitutional remedies of the parents will help to treat the kids. With these few points, I congratulate the speaker, and I am very happy for the listeners and the audience, and Dr. Venugopal, who is very particularly requesting me to interact with the audience and the speaker. Thank you very much.
Thank you, Dr. Janardhan Reddy, sir, for giving more orientation to the subject of autism and the role of our therapeutics in actually playing out this disease and seeing that this is as much as possible exterminated. This is not a subject which is very easy, and our speaker this evening tried his best, and he has showed a wonderful case of a child of autism with psoriasis and how well the child has improved with just one remedy over a period of just 3 months. And Janardhan Reddy sir, in his own style, has also told us the beauty of argentum nitricum and other drugs that can play a very good role in this disease. Thank you, sir. And it is also the duty of Homeopathic Medical Association of Telangana to thank our first speaker, Dr. Murali, the Vice Principal of Dev's Homeopathic Medical College, who presented some beautiful cases and how well they have responded to treatment with our simple remedies. Truly, sir, when it comes to the larynx, the area of the larynx, the seat of action, our remedies are second to none. And needless to say, the practitioners of mainstream medicine, though vying with each other with us, but when it comes to this area, they have no doubt in their mind, if they have an idea of homeopathy, that they have to, send this patient to a practitioner of homeopathic medicine. And it was a nice case where you enumerated the action of causticum and antimtat, irrespective of the number of doses or the number of times that it is given and where it is given, the result finally matters. And we have clearly expounded the result in this case. Also, the first case where the simple submucous cyst, which looks simple but troubles more the child and also the parents, and worry the doctors more with a dose of meserium, how we have brought it to normalcy. And in fact, I have a good friend pediatrician who says we get paid for consultation for one patient, and we have to treat both the child and the parent also. So that's how tough pediatrics is, and that's how good Dr. Murali is. Thank you, Doctor. Thanks to also our good friend, Dr. A.M. Reddy, for focusing his energies on the field of autism and doing his best to work on this area, which the mainstream medicine as of today does not have any role. If there is any role for autism in its cure or in maintenance or management or the better effects, it has to be only this. And he is a very passionate homeopath, very daring entrepreneur, and we wish him all the best. And we, as of now, his company has 50 clinics of homeopathy in across the states, and we wish in the days to come that he expands all over the country and helps more patients and serves homeopathy for a long time. And I request our organizing secretary, Dr. Raghuram Garu, to come over and present. I'm sorry, before that, Dr. Chamun will come here. Sorry. Thank you so much.
Thank you so much, sir, for sharing your valuable words. Now, I request all the dignitaries to come onto the dais to honor the speakers. I request Dr. Gopala Krishna, sir, Dr. Durga Prasad, sir, Dr. Venugopal Gouri, sir, Dr. Anand Rao, sir, Dr. C.V. Swami, sir, Dr. Manik Prabhu, sir, Dr. Rajeshri ma'am, and Dr. Raghuram, sir, to please come onto the dais to honor the speakers. We request the dignitaries to honor our speaker of session 1, Dr. T. Murali Garu. I request all the audience to give a big round of applause for the speaker. Thank you, sir. Now I request the dignitaries to honor the speaker of session 2, Dr. A.M. Reddy Garu. I request the audience to give a big round of applause. Thanks to all the dignitaries. Now I call upon Dr. Raghuram sir to present the vote of thanks.
Good evening, everyone. We'd like to thank Dr. Murali sir for a wonderful presentation, pediatric cases, particularly surgical one-sided cases. And your thoughts on the recurrent laryngeal papilloma really enlightened. Dr. A.M. Reddy sir, thank you for a wonderful presentation with autism and homeopathic treatment. And also like to thank Dr. Janardhan Reddy sir for your valuable inputs about ASD. We'd also like to thank team AMT for organizing such a good seminar. Thank you so much.
Thank you, sir.